Hi everybody, my name is Tasia Marquez and I am 30 years old. I live in Bellingham, Washington. If you don't know where that is, it is close to Seattle, Washington. I was diagnosed with MALS in January of 2020. I have a pretty big backstory as to how and how long and how many doctors and all of that. It goes into quite detail, so bear with me. Ever since I was a little girl, I have had symptoms of MALS, but nobody was ever really able to explain the symptoms and link them to it until just 2 years ago. And so it's been a very hard road, and I have had to advocate for myself so much just to be able to get to where I am today. But I would not change that for anything. And I am so happy to even be part of this documentary, to be able to help bring awareness and just help the world learn more about this illness, because it is consuming and it is hard and nobody really understands it. So, growing up, I was not able to do physical activity without feeling like heart palpitations or just having extreme pain. I would get really dizzy, and so it just made it to where physical activity and me didn't get along. I then was always very thin. In my younger years, I was able to eat okay. That wasn't quite an issue, but I would feel nauseous sometimes and would get like an acid reflux feeling in my stomach. So fast forward to many doctor's appointments, in and out, being told that everything's fine. I get pregnant with my first daughter when I was 20 years old, and I started showing symptoms of varicose veins and just being very fatigued and not being able to stand on my feet for more than 15 minutes without feeling a heavy pressure, dull, achy, and just all around throbbing feeling in my legs, along with horrible pelvic pain, left flank pain, and then obviously just not feeling well on top of all of those symptoms. I thought I was going to have a natural birth, and those plans did not turn out the way that I had expected. I ended up having an emergency C-section, and 4 days after, I was admitted into the hospital with toxic shock syndrome. And that is a horrible staph infection that almost took my life. I recovered from that, and my varicose veins still didn't go away, and I was still feeling a little bit off, and then I was pregnant again. So I went through my second pregnancy, and the symptoms only got worse. I was still having the heavy pressure pain in my legs. I was still unable to stand for more than 15 minutes. I was feeling dizzy all the time and just really, really, really nauseous to the point where I was not able to be up and about for very long. After that pregnancy, I really tried to figure out and get to the bottom of everything, and everybody said that I was just fine, that it was just my body readjusting to, the healing process, because I had 2 C-sections back to back, and it was just trauma on the body and all of these excuses as to why I was feeling this way without actually looking into it. Fast forward to a year and a half later, I have my 3rd daughter, and that pregnancy was the hardest. I was literally so nauseous, and the morning sickness that is normal was like 10 times as bad as anybody that I had ever met that went through a pregnancy and had those feelings. I was literally bedridden for the first couple months of my pregnancy, and I just ended up, not having the best time. I was still having all the same symptoms as all of my previous pregnancies, and then I gave birth, and the healing process was, slow and steady, just like the other ones. I ended up getting 2 separate infections that landed me in the hospital with my 3rd daughter, and so the recovery was hard, to say the least. After recovery, I was still not feeling better. I was still having horrible pain, flank pain, abdominal pain, pain in my upper gastric area, my leg pain, and then I started bloating really badly to the point where I thought I was maybe pregnant again, because I was having all of the same symptoms, and I was having some urinary issues, constipation, and then diarrhea. It would change so quickly. So I sought out help, and I went to my OB, and she really just took her time, and I was in her office for over an hour, just giving her a rundown of all of my symptoms, when they occur, all of this and that. She did a pelvic exam, and I was able to feel her pressing around up in like my upper gastric area. And she says, "Oh, that's not normal." And I said, "Well, I told you that my veins, they didn't feel right, that something in my body there's something going on." And so she went out, did a little bit of her own research, and came back in and said, "Oh, well, looks like you have pelvic congestion syndrome, which is a whole bunch of varicosities in your pelvis." So I went home, I did my own little research. I said, "Oh no, this can't be it," because I just didn't understand it. I found some women on YouTube, and it led me to a support group on Facebook that forever changed my life. I cannot thank all of the warriors on there for all of their guidance and help, because I would not be where I am today without them. So on the pelvic congestion syndrome site, I was able to find some doctors in the area. I got referrals, and I started my journey. I went and I saw an IR, who then he referred me to a vascular surgeon, Mark Meisner, at the UW in Seattle, Washington. He is the one who fully diagnosed me with my pelvic congestion syndrome, May-Thurner syndrome and my Nutcracker syndrome. The May-Thurner syndrome, if you have not ever heard of it, is a compression of the left common iliac vein, and the Nutcracker syndrome is a compression of the left renal vein. Going into the very first procedure that I had with Dr. Meisner, he did not tell me that I had a compression above and below where he was wanting to coil off. With all the research I had done, it pointed me into the direction of not doing that, that it would only make me worse, and it did. So we coiled off my ovarian veins, unaware of these compressions myself, and it literally made me even more bedridden than I was before. I was to the point where I was unable to take care of my children. I was unable to work. Before I was at least able to push through the daily feelings of the nausea and dizziness and pain and fatigue and still live a semi-normal life. After the coiling of my ovarian veins, I was unable to do that. It only made the pain and the nausea and the dizziness increased. So then we stented my left common iliac vein to open back up blood flow because it was over 80% compressed and my left leg was not returning blood back up to my heart the way that it should have been. That helped a little bit with some of my, heaviness and pressure, pain in my leg, but it really didn't help with overall dizziness, nausea, pain, fatigue. So then I kept doing my research, and I ended up finding a Professor Thomas Skolbach, who is in Berlin, Germany, and he has knowledge of all of these compressions and how they are interconnected and ways to treat them without making it worse. So I went over there for a second opinion, just to see, a full overview of what was going on in my body before doing any other procedures, because I didn't want to further damage and further render me from becoming better. So, we made that journey, January of 2020, and that's when he found the compression of my celiac artery, which is called MALS. And I was so astonished because I had mentioned it to Mark Meisner, and he said, "Oh no, that's not a thing. I really don't think that you have that." So getting that validation really felt so good. It was like a sense of weight being lifted off my shoulders of, not being heard, and all of my symptoms were just, me overthinking things, and I finally felt validated and being able to say, I have, multiple compressions inside of my body, and that's why I'm feeling this way. It really felt good. So I ended up bringing all of that imaging and knowledge back here to the United States with me, and I sought out a surgeon who would, take on my case. I was willing to travel if need be, but then again, I was just scrolling on our support groups and on the MALS awareness, I saw a post from a woman who just recently had surgery with a surgeon that was close by. I reached out to her, got all of his information, and I made my consultation appointment with him. His name is Benjamin Starnes, and he is the chief of vascular surgery at the Harborview Medical Center in Seattle, Washington. And it has forever changed my life. I know that everybody's MALS journey is a little bit different, but I can honestly say that it has helped my overall well-being. I went and we, had our consultation. I told him where I had been, what I have done, all of the research and advocacy I've done for myself, and he took my case on. He did his own imaging. We did the CT. We did the plexus block. I had a successful plexus block, and I was able to eat without increased nausea and without increased pain, and it was a good feeling. So I ended up having to wait a little bit due to the pandemic, but I had my surgery on August the 5th of 2021, and the recovery was hard as I had prepared myself because, watching other warriors in the group go through it and take advice from them, it really helped the process so much more than I had even imagined. And so it took me about 4.5 months to start feeling semi-normal. I call myself a normal abnormal feeling because the way that I feel is different than everybody else, but it's my normal. I have less pain in my upper gastric area. I still have pain there. It's not gone, but it has improved immensely. I am no longer nauseous 24/7. I still have spouts of nausea. I'm still dealing with symptoms that are mimicked from the MALS that are due to my nutcracker syndrome because it is still untreated at the moment. I am not feeling dizzy 24/7. I am able to at least get up and live a semi-normal life and do the little bit of chores around the house that I was not able to do before. I still do have chronic pain. And it's not only due to my MALS. Like I said, I have multiple compressions that are inside of my body, and it's something that I have to deal with. But I kind of want to hit all of the points, and I feel like I've kind of done that, but yeah, how do I feel now? I'm feeling a lot better than I was. How was I mentally? Being an advocate for yourself, it takes a big toll on just our day-to-day lives because we become so wrapped up in figuring out what our next steps are and, who we need to go see and what needs to be done and making sure that we're doing everything that we can to feel better. It really is draining. So I see my therapist every 2 weeks, and just to be able to talk and get it out and understand my emotions, it has really helped a lot. I have been tested for EDS vascular. I was told that I was tested for all the others, but I would like to see that on my chart, on my chart, or on, where you get to see all of your medical records, because the only one that I can see is the vascular type, which I do not want. Nobody wants the vascular type of EDS. So that is one thing that I am pursuing, is trying to see if I can rule out all other spectrums of the EDS. I would love to show a glimpse of my scar. I did have a open procedure, so I have a pretty good sized scar, but it has healed up very nicely. I am very happy with the work that Dr. Starnes did, and that leads me to the next question, is whether he would be part of this documentary. And I am pretty positive that he is more than willing to, just for the fact that I sought him out when he was in the very beginning stages of even trying to remotely start doing these procedures. This is not something that he's always done, and he is wanting to learn about it to the best of his ability and try to help as many patients as he can. How many doctors did I see? I have seen multiple doctors, over 20, and, multiple doctor's appointments with each of them. And I guess, how long was I sick? Well, I kind of already answered that, but for my whole life, bedridden sick. I was bedridden sick for about 5-6 years-ish. So I can say that I have had improvement, and I'm still advocating for myself and still trying my best to just do what I need to do to live a semi-normal life. I really appreciate being able to be part of all of this, and I would love to do more if the time or opportunity presents itself. So please don't hesitate to reach out and ask any other questions, or if I left something out and you want more details, don't hesitate to ask. But thank you again for letting me be part of all of this. Have a blessed day, everybody.